got one dirty needle stick in 25 years. And it was because I was rushing, it was the end of the day. I had a dinner date with my boyfriend, I was meeting his mother, I was nervous, I was anxious. And my last patient was, had suffered severe brain trauma. He had shot himself accidentally in the head. So he was a bit of a challenge to work with. And I couldn't get blood from him. I had to do a butterfly on the back of his hand. And when we get to butterflies, you'll see they're on a little tiny tube. You probably know what a butterfly looks like. Sorry, Tom.
No problem.
They kind of bounce around. So I'm going to be real adamant about you not letting go of those butterfly wings until it's in the sharps container. Okay, to let go and kind of let it dance around is just asking for trouble. Now we have nice needle guards too that will protect us. But my whole issue is your safety, okay? You guys are gonna have a great career. Let's not take any chances, okay? The gloves are for you, the goggles are for you, the PPEs are for you, you know? Everything you do is about your safety, okay? Yeah, we want to minimize the patient's discomfort. We want to empathize that they're nervous or anxious, but still, it's all about your safety, okay? So I also brought in some wipes. Remember, anytime we're working with bloodborne pathogens, we need to clean that down because hepatitis B can go into a spore form and live on a countertop for years. You learned that in what, week 2? Mm-hmm. So anytime, even though I have a tidy towel, it's got a plastic liner, and that prevents any bacteria that's on this tray from wicking up into my materials. We still want to clean it down. Alcohol doesn't sterilize things, it doesn't kill bacteria. All you're doing is literally moving the normal skin bacteria on your body. So when we get into venipuncture tomorrow, we start at the intended site and we work our way out in a spiral, okay? If we were doing a surgical procedure, we'd actually do that 2 more times to clean that area. There again, the alcohol is only 70% isopropyl. It's not gonna kill everything. It's only gonna move the normal skin contaminants away from the injection site. We have bacteria and fungus all over us, right? Mm-hmm. So that's what we stand at risk. Anytime we puncture that skin, that suit of armor, we are susceptible to any type of infection. So we have our alcohol, we have our little cotton balls, and these are lancets. They are not a needle, they are actually a little surgical blade. So we just twist this off, okay? That can go in the regular trash. This is going to go into a sharp container. Even though the sharp isn't exposed, you just don't want to take that chance. And what you're going to do is you're going to, if this, oh, you're going to love this one. This is a finger. No, that's not a good finger.
It's like E.T.'s finger.
I know. I have to go back to Art 101. This is fingerprints, okay? So that's pretty much how they run. What we're going to do is we're going to take your tall finger or your ring finger. These are the 2 fingers they want you to use. I don't know why. Yeah, I do. But, I mean, we have 10 fingers. It's all the same blood, right? But there are less calluses here. You want to avoid any bruised, injured, or calloused site. So if we actually puncture the pad of the finger, there's a callus there. So we're going to do the side. And we're going to come in with this lancet on the angle. We're not going to go straight up and down. We're going to go across the grain. So when that little blade comes out, it's going to go like that. If we did it this way, what would happen would be the blood would trickle right down that fingerprint. By coming across the fingerprint, it will pull up a real nice drop of blood. That's exactly what we want, okay? So, a lot of times you want to, you're going to wash your hands, you're going to glove up, you want to grab your patient's hand, see if they're cold. Especially senior citizens don't have good circulation. So maybe they need to rub their hands together, okay? Maybe they need to even run them under hot water. We have to have blood supply there, okay? So once you find a finger or a site that you want to puncture, you are going to clean it with the alcohol in a circular motion and set it aside. You're gonna take your lancet. Test question, this punctures 2 millimeters deep, okay? 2.0 millimeters, that's a theory review question. And then we're going to puncture it across the fingerprint, and we just push down, okay? You don't have to push any buttons or anything, you just push down on this, okay? I guess I should probably take this glove off so you can see. Gonna clean my finger. Gonna let the alcohol dry, because otherwise it burns a little bit, right? Then I'm gonna hold the lancet across the grain, push down, and I have a drop of blood. And I bleed because I'm on blood thinner, so sorry guys. Then I'm gonna I wipe the first drop away because it has alcohol on it, and it also has interstitial fluids. Now we've got a nice drop of blood that's not running down the fingertips or the fingerprints. This is a hematocrit tube. And we can use this, in the old days we used to use this, and see how it just kind of sucks up the blood? You could fill up this whole tube, and just by putting your finger on this, I'll show you how to make a slide. We'll make a slide for a differential. But I'm gonna put this in my sharps container, because that is glass. Put a little pressure on my finger. The other thing we're going to do is a glucometer. This is something that a diabetic person would use to test their blood sugar. And they could be testing as many as 4 or 5 times a day. When you open this kit, the important thing is to find this number on the side, 4839. This comes out. So when we put a new container in this kit, we put in this new number, this new code number. Why won't this go in? And you want to make sure that it's the same as this, 4839, 4839. Good. All right, so this monitor is asleep. As soon as we stick the strip in, it turns itself on, okay? It's confirming that the code is correct. If it comes up E, that means E for error. Whoa, we've got a spurter. Jeez, never done that before. All right, so I've got this drop of blood, and all I'm gonna do is just touch it to my finger. It will wick it up is the term. It just wicks it up, and it will count down. Give the patient another cotton ball. And I'm coming in at 112. Okay, you need to know that normal range is 80 to 120, okay? 80 to 120 is normal fasting blood sugar, and that's what we call an FBS, fasting blood sugar, 80 to 120. Now you'll see as we start doing this week, you come back from break, you've had a soda, you've had a candy bar, you come in at 150 to 160. Are you dying?
No.
No, that's just normal. You ate. Your blood sugar is going to elevate, obviously, when you eat, especially sugary items. Then the pancreas is going to start producing insulin, and it's going to bring it down. So you'll watch how this changes. If you stuck yourself like 3 times in 5 minutes, you're not going to get the same number. It's constantly moving. So when your blood sugar, let's say this is a normal range. This is 80 to 120, let's say. And you eat something, and it spikes. Let's say you have sugar. Then you don't eat for several hours, and it drops down below. That's not good. Any of these spikes are really tough on your system. What we want is kind of a normal, gradual range of high and low within the normal values. anytime you spike a peak like this, it's really hard on your kidneys. It's hard on your ophthalmic nerve. You can cause diabetic retinopathy is the term I think I need. And also idiopathic or diabetic neuropathies of your foot. So diabetes has 3 very serious repercussions. You can lose your vision, you can lose a limb, your foot or your leg, and also your kidney function. So really not a good disease. We want to stay within that 80 to 120. If we come out a little bit and we're up to 150, or we're slightly down, you know, a little low, that's all right. We just don't want to come up here to 400 and drop down to 30, and come back to 256 and come down to 70. That's just too much for your body to handle. It's really important that you eat every 3 hours. You eat protein, watch your carbs. Don't, you know, carbs have got a lot of sugar in them. There are good carbs, like fruit are good carbs. Even vegetables are good carbs, but some are higher than others in sugar, like corn obviously is going to have a higher glycemic index. Carrots, higher glycemic index. So you just have to be aware of what you're putting in your body. Think of it as a Maserati. You're not going to put cheap unleaded gas in a Maserati. You're going to put premium fuel because you want it to run well. So this is your Maserati we're talking about. Now when you finish with this, we're going to put this in a sharps container too. It's only plastic, but it's got blood on it. Let's just be safe.
You just pull it right out of there?
You do, just pulls out, just pushes in and pulls out. And let's see, what else?
Excuse me,
and
what do you call that instrument?
this one,
Mhm.
this is called a glucometer, okay?
Okay.
Like glucometer, glucometer. Glucometer.
And how about the other one that you,
This is a hematocrit tube. You'll learn what a hematocrit is. This is actually a micro hematocrit tube, because it's an itty bitty one. The other one we're going to learn today is a hemoglobinometer. Hemoglobinometer. So we know hematocrit and hemoglobin are 2 elements of our red blood cell. Hematocrit talks about the volume of our red blood cells. How much blood do we have? Are we bleeding out? We're not going to have a very good hematocrit. The hemoglobin, which I think is the most important cell in the body, is what carries oxygen. Without the hemoglobin, we couldn't get oxygen to every cell that we need. So hemoglobin is very important. Normal range on a hemoglobin for a woman, 12 to 16. For a man, 14 to 18. You need to know these. Okay, so what we do on this one, and these are very, very expensive. These are called microhematocues, hemacues. And we're going to plug this little machine in, turn it on, and I'm going to open this little window. Let's see if I can still bleed. No, I'm actually clotted.
So we're gonna do more than one finger prick today.
Yes, we are. We have 10 of these to do. All right, so,
one on each finger?
or you can use somebody else. You can use some of your own fingers if you want. But I also want you to learn the technique of holding the finger securely. Oh, it is bleeding. Maybe not enough. All right, so I'm going to stick it again. What am I going to do?
Wipe the first drop.
Wipe the first drop away. Why?
Because it can have alcohol on it or any other
and
foreign things from our
Interstitial fluid, very good. So we're going to take this cuvette from the Hemacue machine. Look at this big drop of blood. And all I'm gonna do is touch it to the top of the blood and see how it sucks it up. You can be smearing it and moving it around like this for 10 minutes, you know, and it just doesn't do any good. You just touch the point and it will just suck it right up if you do it correctly. Now remember, most older people are on blood thinners because they have arthritis, right? So they're going to bleed easily. Make sure you have a Band-Aid ready for them. Because you saw how long it took me. I still hadn't really clotted all the way. Now, you take this Hemocue or cuvette, you put it in this machine, the hemoglobinometer, and then I'm going to close it. And hopefully it's going to say, go. Sometimes I have to jiggle it.
Those things are stubborn.
Sometimes, yes.
Oh, I just wanted to see how,
Sure.
how it inserted in there.
It just sits right in there. You can only put it in one way. Okay, so I'm 15.5. 15.5. So I'm good. I'm on the high end of normal. Anybody here a vegan? No vegans? Okay. A lot of times our students from Egypt, they don't eat a lot of meat. And they are very low on their hemoglobin. What happens if you're low on your hemoglobin?
Need protein.
What?
I think I don't know, maybe you need protein, need something in your diet.
Yeah, you're tired, you have fatigue, you have anemia. You've heard that
I'm
word
anemic,
before.
yeah.
Okay.
All the time.
So if you could get your
Iron.
up and not be iron deficient, anemic,
Mhm.
you would have more energy,
Absolutely.
for sure.
I have to take iron pills for it.
It's
and
very
B12.
hard to assimilate iron pills.
Mhm.
The body just has a real hard time doing that. It's also tough on you. It can
Digestive
give you
system.
indigestion, you can kind of
Constipating.
regurgitate it, and it's also constipating.
Yeah.
So, and sometimes your stools come out looking very black and you're thinking, oh my God, what's going on? Iron is just really hard. So there's a product over the counter that my doctor used to recommend called Slow Fe or Slow Iron.
Yeah.
Fe is the elemental sign for iron, right? Markers. Fe is the elemental sign for iron.
Mhm.
So if you saw Slow Fe, you would know exactly what it is. And your body assimilates that much better than some of the other iron products. Okay. Any questions on this, guys? So there again, we want to make sure this goes in our sharps container. I'm actually going to clean out this little area because I had a lot of blood on that little cuvette. And then when I pick up my tidy towel, then I'm going to wipe it down with the cold sterilization towel. Questions? Okay, let's go do it.
Well, one of the questions in there.